All right. Good. In Dubai time, good afternoon. Thank you for joining us. I just got told by Arthur that we're getting a full house. So I think the capacity is 250 and we're getting a full house. So we apologize for those who couldn't join us. But I believe we'll be doing something like this again with another country. And then we'll send the same notification to everybody to join for those who missed this one. So good morning, Amy. Good to see you. So welcome to this seminar. And basically, as you can see, the title of this talk is the Aesthetic Medicine Industry Post-COVID. And I think it's extremely important topic, given the circumstances we are in. And I want to really make it really short and then go back and then make it a discussion, because a lot of the people who are attending this session are actually either in business, in the aesthetic business, they're managing businesses, or they're doctors who are have their own clinics, or practitioners, or those who are in this industry somehow. So I think it will be really useful to open a discussion later on and take questions, and then take people comments, and then share so we can learn from each other. So without further ado, Arthur, if you can go to the next slide, please. So this slide came from KPMG. It's one of the largest consulting companies in the world. Government consult with them, big businesses consult with them. And they put a report during COVID, and they want to show the industry that will be affected by this infection, by this pandemic. And I want you to pay attention to this part here. I don't know if my pointer works, but the one that's in blue are in risk, and the one in orange are in high risk. And we are in the education and health, the one in the middle. So you can see we are not in really high risk, but we are at risk, and we are really borderline on being in high risk. What does that mean? Is our industry is quite solid, and it's quite have very good foundation, but it also linked to other industries. For example, we link very nicely to the hospitality and leisure thing, because as you know, aesthetic is enhance people's life, increase their self esteem, increases their awareness, make them happy. And so we are in this kind of field. We're also in the manufacturing, because we, as practitioners, we are really impacted by manufacturing, because imagine all the manufacturers stop producing Botox and fillers and skincare and all this thing that we utilize in our practices. So we will be at high risk. So we are linked in multiple things, but we are positioned really nicely. But that doesn't mean we have to take our eye off the ball here. So we have to be careful how to proceed after this period. What do we need to do to make sure that we are not affected? And I'm going to share some of my experience and what I've done with AQ. So hopefully you guys can learn and you can adapt your practices with. And so I'm just, can you go to the next slide? And also I'm encouraging people to write questions as they see. They don't have to wait at the end. So if you have a question, you want to raise it up, just type it in the Q&A, and I can look at it and then address it while I'm talking if you need to. So what the global impact? So now when this was published as of March 20th, 183 countries have been impacted. Now we know almost everybody's been affected. A lot of the countries who have older population are max risk. Social distancing became a necessary part of life, and how this will affect the economy is something that we have to keep in mind on. Government offered to mitigate the economy by giving stimulus, by reducing costs. In the UAE, for example, they are reducing rents, and they are doing a lot of the support to businesses, and then taking fines off or reducing licensing process and so forth. So this is something that that this government, and also coordinating individual with government action. So it's very important to understand what the government is offering and how you can take part of that. And then the shape of the economy. So I'm going to show you right now 3 scenarios that mostly will impact us going forward. And I want you to pay attention to this figure, because it's really will help you plan your next action. So Arthur, can we go to the next slide? Hi, Charlie. It's good to see you. Well, I am following you on social media, so it's good to hear from you. I'm happy you're following us. So let's look at the economy versus time. So what do you expect to happen in the next period as we go on? So the first graph here on the left, you can see it's linear, and linear meaning that when things start going back to normal, you'll see an increase or gradual development, and the business just will keep climbing. And a lot of the businesses, a lot of the governments, as well as businesses, are looking forward to this bounce, because the bounce, so it will shoot up until, you know, forever, if you like. But nothing lasts forever, but it will just keep climbing. So this is indicate that there will be a linear. Once the people comes out of this lockdown, they will just go and consume and start going back faster to their normal life. So this is a prediction. Unfortunately, it's unlikely, but what a lot of government are telling their people about it, like, you know, we'll have a quick bounce back. Once the economy is open, we'll just things will just start picking up really quickly. And a lot of people disagree with that. The second graph is, as you can see, is going, once things start opening, it will climb up, and then it will let it stay a little bit, and then will go down again. And this is because when things start opening up, people who have money and people who have steady or security, and they're not so much affected by this, you know, will start going back to their normal life, and then their numbers will be, you know, their reach. So let's say 1,000 people will come out of this, and then they start consuming, they start getting all treatments and getting Botox and fillers and skincare and treatments, hair complex and recovery treatment and all the things. And then once this burst or this release happens, then the economy will go back again down, because now the people are, those who have lost their job, those who are trying to figure out what they're going to do, those who are impacted by this are not going to be consuming, and this is not a priority for them. So you'll see a dip, and then again there'll be a climb again when things start building up and the economy start taking its course. This is most likely to be the scenario, and this is what all economists and all people are predicting. And also they compare it to other models that happened in the past, like 2008 recession, like the you know, in the past during the World War II and other Gulf War, for example. So there's a little bit of a sigmoid, if you like, reaction. And then the third one, which is also being predicted and suggested, that, you know, when things open, things will start going up slightly, and then will level, and then there'll be slightly increase in slow pace. And a lot of people say this will take years. I'm talking about 1 to 2 years until, you know, we see our normal businesses that we experienced before COVID. So these are the 3 scenarios that people are predicting will happen. So what does this mean to you? How is that important? Well, if you start planning and the linear that things will just keep going, then you will start doing a lot of investment ahead of time. And then you might not see the reward for your investment, and then you just put yourself back. So it's really good to take part right now in planning and really shoot for a big increase at the beginning. You know, once things start back opening up, there will be, hello Greece, I saw you, good to have you. So when things start going up, you will see demand, and then it will start going down. So it will be really important for you to plan that, you know, there'll be a very good increase, and because at the beginning, but then I have to be very cautious. So you have to start building your infrastructure. You have to be careful not to overspend, but to spend carefully. And the third scenario basically saying that, you have to anticipate the peak so you can take advantage of it, and then also make sure that you manage your business in a steady way where you keep the supply and you keep the services, yet don't expect a lot of return and back. So these are the three scenarios that you have to keep in mind moving forward. Can we go to the next slide, please? So what have we done for let's go to the next slide and then I'll come to this AQ news. Sorry. Yes, so what have we done as AQ? So what have we basically as a company, what have we prepared for this time? Hello from Belgium, hi. So we start working with our partner to increase awareness of the treatment. So here we start working on the education process. So we went to our partners and we said to them, what can we do for you? What can we provide that to help restore your businesses? And we realized that by talking to some of our contacts and partners, we realized that we need to tell people what treatments are available. So let's say, for example, you're being cooked at your house for the last 3 months, and then you want to see, listen, I need to take care of my hair. As you know, stress has been huge. Thank you, Andrea. So it will be really important for us to know what treatment, or the people who are at home, what treatment they would like to have. So if somebody have problem getting losing hair during this period, which is very common, and I've seen this being sent to me personally through like social media and emails, and we saw a lot of people emailing AQ asking them, I've been cooked in my home, I went through stress, now my hair is falling off, what can I do? So it's very important to highlight the treatments available. So listen, hey, AQ have a great treatment, it's been published, it's one of the best treatments in the world for hair treatments. It's simple, it's affordable, and the results are almost guaranteed. So in this case, people know once they are open and are allowed to go out, they will come and seek help for their hair. The same thing we do with for the treatment for the skin, for multiple things. Also, we decided to do a lot of training. So right now, these people who've been a practitioner or doctors who have been losing business for the last 3 months, they will start looking to reopen and start building more business to make up for the last 3 months. So training is very important, because remember, if you haven't been practicing for 3 months, or you haven't done treatment for 3 months, or you haven't seen a patient for some time, you start losing confidence that you can do the same job or you can do the same treatments again. So providing trainings back and reconnecting with your practitioners is very important. We also did sign up for major conferences around the world, and we did this to really expand the brand awareness and to also regionally help everybody. So one of the major conferences that we really partner with is the one in Monaco in November. I felt like November is really good time, that by November we will see normal, whatever that is, but I believe normality will come back by November, and then a lot of people will want to go out to conferences and want to learn and want to reconnect with the industry. So we participated with Monaco, and we became a major sponsor in the event, and they promised us to give us an entire 1 hour during the conference, during the high time of the conference, to conduct education and training and awareness of the brand. And this will help all of our partners worldwide to really reconnect, and then our practitioners and the doctors who've been working with us, or the new doctors who wants to come and learn about the latest treatment and what we offer. So this will be a really good way to connect. So obviously Monaco, MCAS, and then some other international. In America, these conferences are taking place in September and some in July. I feel it's too close to call. I'm not sure this will happen, but indeed, if we see that it's an opportunity and there's an opening, we will be participating. Working with doctors and clinics to increase patient visits. So how do we do that? One of the things that we at AQ we find, hi Michelle, we find it very useful, and actually our social media. So as you know, AQ is have a vast network of or over 50 accounts worldwide of social media. So every distributor have their own social media network, and then they reconnect everybody. So imagine if somebody have done something in the UK, for example, hair treatment in the UK, and they got great result. This treatment will be echoed worldwide. So you hear it in Indonesia, in Japan, in Australia, in South Africa, in America, in Turkey, in the Middle East, in Egypt, everywhere. So it will echo everywhere, and this will give awareness of the doctors' work, and then the doctors will be really having a free promotion for their treatments and their skills throughout our platform, which is global. So this is really an important thing. So we start investing a lot of money. You're going to notice very soon that we invested a lot of money in awareness and in social media. Also providing marketing tools and promotions. So one of the things that we've started doing, or we're planning to do right now, once this comes out, and we're going to start, I think, by June, is we start providing promotion tools and marketing that doctors and clinics, that our partners that work with us, that they will be able to display to their things. Like, we'll start giving them some discounts on products, that so they can do promotion, and then the patient will be able to try the product, try the treatments, and then it will yield in more return in the clinics, as well as the reward with the patient. So we're going to start doing a lot of that from our part, just to make sure that we're telling our clients and we're telling our partners, it's that we are with you and we're going to support you. You support us during the good times, and now it's our time to support you during these bad times. A lot of the companies who are in this field, unfortunately, have taken a very selfish approach to self-sustain and be really selfish. And I'm not pointing at any company, but we are in the industry, and I'm very familiar with everybody in terms of personal friendship, and in terms of we sometimes conduct meetings and to talk about the industry. And a lot of the companies, unfortunately, have taken a very selfish approach. I propose that we all have to do something to bring back, awareness, and even to do TV ads, and some of the doctors who are working with these companies, who are, celebrities in their own right, and they well known, to come out and speak about the treatment, speak about, how to go to visit your doctors and how to get the treatment, and take away the fear from this treatment. A lot of people are saying, I'm not going to go get my Botox, or I'm not going to go get a microneedling treatment with AQ because I'm so worried that I might get infected by COVID. So we have to go ahead and reassure them from the doctors, saying, listen, it's safe. The doctors are trained to handle. Are we able to get a recorded copy of this in stock list? Yes, I think so, Amy. Arthur will start recording this. It's recorded. I can see it. So I think it will be recorded and we distribute it to everybody and make available, because I get a lot of texts as we speak right now saying, I can't get on. Can you record it for me, please? So I hopefully we can do that. So a lot of these industries, the companies have been doing very well, partnering with doctors, in the good times. And now during the bad times, I think the companies have to go back and say, hey, we need to start promoting the doctors at the clinics and get them back to where they were. So it's really a good time, and to see that, which company will stick around and push the business, and what company will take a service approach. So this will be a learning experience for us. Next slide. I think the news, warmest greeting from Malaysia, AQ Malaysia, Dylan and everybody. We miss you and hope to see you soon. So what have we been doing lately, or what the latest news? So we had a very nice scientific paper published in April. We made it available for all of our partners, and it's been in social media. What happened? Okay, so Arthur, I think you need to put it in the show mood. So we had published a paper. Yeah, thank you. So we have published a paper, and it's using, basically comparing the use of acute recovery for post fracture laser, and the results are fantastic.
It's really good paper, and it was written. It wasn't even supported by us, or we haven't paper. It's actually done in a university, and then they sent the paper for me. I woke up in the morning and I found the paper, and it was really nicely done. So I congratulate the team in Egypt and everybody, our doctors and partners in Egypt. We also finished a clinical trial on a new product plan that we are been working on for quite some time, actually. And this is, as you know, AQ, it takes us a lot of time for us to to get a new product on the market, because we have such a huge reputation and our product is extremely solid and effective. So we cannot just bring any product, to increase business. But once we introduce the product, it has to be an extremely well done. It has to be well formulated. It has to be extremely effective. So the brand AQ does not lose its standards. So we've been doing a lot of clinical trials, serious clinical trials for some time right now for our new product. Yes, this has affected us and delayed some of the result. And of course, we asked the patient to come to follow up with the result, but because of this, we could not do that. So but we are in the latest stage. So hopefully when this comes out, we'll make announcement. We are now in 7 countries. Even during the lockdown, we realized we decided to even further expand. We don't want to stop our expansion. So we took the time to to really set up the new countries. We are in India now. I'm happy to say that we are in Estonia. And all the Baltic regions, so Estonia, the Latvia, and the Slovenia, or Slovenia. I hope I got it right. So, we are this making it over 60 countries worldwide, and we are also officially the largest GF producer in the world. So we have done tremendous amount of work during this time, because we've been so much busy building and expanding and really supporting our international network, that we realized since we're going to be stopping for the next 2 months or so, it will be worth it for us to go ahead and start investing in our infrastructure and build up quite an extensive manufacturing capability. So to make us the largest. We were the largest, but now we are pretty much the largest growth factor producer in the world. And we can supply, India has been in the waiting list for some time, because once we go there, we have to make sure that we have enough supply for it. But we have built quite a good infrastructure for our manufacturing. Even during this time, we were able to support and ship products within 2 days whenever we get the orders. So we are very proud of that. India, the Baltic region, the Italy. I'm very happy to tell you that our Italian distributor Stefano has and all his partners and all his staff and his wife are safe. I am in continuous contact with them to ask them, because Italy got hit really bad, and Stefano actually from Milan, so it's the epicenter of thank you, Sarah. It's really an epic center for the impact with COVID, and they lost a lot of lives, as you know. So we were really worried about them, and I've been in contact with them constantly to find out that they're really doing really well and they're safe. And actually, we just shipped them an order right now, so they're really excited to work and build up their network and go back to normal life. Also, Spain, I'm in contact with Spain. They're doing really well. They are safe. They are excited. They send their regards to everybody, and they really eager to go back. So we are planning to go visit them, or I'm planning to go visit them by the end of August or early September, if time permits and if things are safe. So, but they're excited. They're going back to normal very soon, cautiously opening up, but they're looking forward to a very successful year. So their optimism is very high. The spirit is very high. So I'm very happy for that. Which else? We are in Italy, they're doing well. Spain, France. I'm also in contact with Veronique. She's doing really well. She's been keeping an eye on the business and her clients and supporting everybody. France have also had it bad, but they're doing really well. So I'm in contact with her, and she's excited. She's participating in Monaco, of course. She's helping us there, and she's also reconnecting with the clinics to make sure that they have the supplies and everything. So she's doing really well, and she also sent her regards to everybody. I don't know what other country. The UK, I'm in contact with them. They're actually listening to us. Charlie, Michelle, Mark, and everybody. I miss you guys. I love you guys. You're doing really well. And the UK has been hit really hard. Hey, Dr. Yenati, how are you from Malaysia? Happy to see you. So the UK got now second in the world in terms of death. They got really hit hard, but that did not stop them from really continuing to promote AQ and to support their clients and continue the education. I saw that Charlie been recording some new segments for us, so I'm looking forward to it. So the UK has been doing really well. So you can tell from all the AQ network that everybody's really doing well, and I've been keeping pace with everybody on almost on a daily basis to make sure that everybody's safe. South Africa is doing really well. I talked to Amy; she's fine. She's devastated a little bit. South Africa, you know, it's not an easy place, but she's really been high when you are expected to share marketing and promotion support at least. So this will come out in June. So in June, we're going to start rolling out things. We're just waiting for the right time. So we're watching this whole thing very closely and to make sure that we know what the right time. But I have to go back to my office in the US once the airports are open. And then, but the team in the US are working really hard right now to put things together. And then we'll make an announcement very quickly and will be rolled out by the distributors. So we will have a meeting with the distributors, and then we'll discuss more details on what we're offering for June. And then the plan. So there'll be quite a lot of plans coming up to support the doctors, the clinics, and I'm tentatively have placed on my schedule that I'll be in the UK after the mid of August. Hopefully things will be back to normal or semi-normal. And then we will do quite a good training for the UK, and then from there I'll go through UK, then we'll tour entire Europe to do training for them, and then the end of the year will be toward Asia and so forth. I will make sure that I'm going to be in South Africa this year because it's one of my target market that we need to promote. So this is so far what we've been done. Now I will take question. Arthur will be organizing it. So anybody have a question they want to share or discussion that they want to bring forth, please do so now. Thank you for your attention. I don't want to make it really long training. It's not a training. It's really an update to things. And if you have question about COVID or anything you want to talk about, we're more than happy to assist. Thank you, Arthur.
Thank you so much, Dr. Ahmed. That was a really good session. Just wondering if you can touch a little bit on what is going to be the new normal for aesthetic professionals in post-COVID-19. Just a little bit on that.
Okay, this was a question. Okay, yes. So basically, you know, I'm an immunologist, so I've been working actually with as a consultant, and I've been participating in quite a debate in the last 2 months since this came out with companies who are in production of vaccine as we speak. And we have been doing very going to see what will be the best way to come out of this. What option do we have in terms of scientific? So like vaccine, combination drugs, and what are on the market. So we've been in quite discussion globally. So there's scientists from Asia, from America, from Europe, from Middle East, and a lot of them are quite famous immunologists, and they've been in the business for some time. And the best scenario that we can see right now is we'll have it coming out. So the vaccine will be basically a game changer for whole things. It will put us back to where we are, and we'll just keep moving on. If the vaccine failed to come, which I have vaccines are very tricky, and it's not an easy thing that you can predict. But a lot of the new technologies that's available to us today, I think we will have a very good chance of developing a very good vaccine that will be effective. And hi, Nasima. So I think the days that everybody's waiting for, or at least us scientists, are June 15th. Around June 15th, there will be the first announcement of the vaccine, first trial. So we will know firsthand what happened, what type of result to expect from. So we'll get the taste of that first. And then, after that, I think June 15th or June, we will have a lot of scientific news coming up. Everybody excited about it. But June 15th, we'll have the first announcement to see how good the vaccine been developed, and if we are going to go into production or not. So in June, we will know. Today, there was an announcement for a new trial, something called a challenge trial. The challenge trial is something that in the normal times we don't do, because basically you take a group of people, two groups. One of them you vaccinate them, and the other you don't vaccinate, or you vaccinate but without any effective epitopes or any effective, basically a placebo. And then you go ahead and you infect everybody. Literally, you give them the virus and have them sick. So you inject everybody, you give them some time to develop immunity antibodies, and then after that you go and you infect them. And so you will expect the people who got placebo to get the infection and show symptoms of the disease, and those who got the vaccine basically don't feel it, and they don't develop any symptoms with it. So this is called a challenge. It's a lot of ethical issue that comes with it, but during these times, could you give us some protocols for use of recovery serum post ablative? Yes, we'll do that. So you give these people the virus, and then you wait. And then you start doing statistical analysis, say, of the people who got the vaccine, they are not affected, and those who got the vaccine or got the placebo are affected. So you do this with numbers. And I was surprised that this clinical trial was approved, and there's 106,000 people have signed for it. They want to take the chance and get infected, and then so they can help humanity. So I was very happy to see that. So this is something that we're looking forward to hear the result of by next month, hopefully, and then we can see. So vaccine is one thing. The other thing that is also on the market is a combination of drugs, and the combination of drugs will be using right now remdesivir, which is for antiviral. It showed that it reduced the viral load, and then by combining it with another drug, that you can tackle two aspects of the viral invasion of the cells. So remdesivir basically prevent the replication of the virus within the cell, and then you have the other drug that might prevent it from entering the cell. So once you have two hands working, two things working on the virus, then you will expect to have very good treatments coming forward. So and can be treated by usually basically giving them drugs, and that's it. So if these things happen and the results are very encouraging, so I think we can go back to normal, given the fact that we'll have supplies. So I really think that can happen. If it doesn't happen, then there will be some precaution like social distancing, wearing masks, and so forth. But I personally know human nature, and I don't think they will be. They can sustain this. I do this all the time, and doesn't work. So this is what I think we'll be looking forward to. So there's some question. I saw it, then they disappear. They say, could you give us some insight in the comparison between a PRP and AQ treatment for skin review? Yes. So as you know, I'm very I speak a lot about PRP and AQ, and I'm not a big fan of PRP. The reason why is because PRP is not specific. You don't know what growth factor you're giving to the patient. You're hoping for the best. You don't know what the patient's status are. And then once you take their blood, you take the plasma, you're assuming that there's a lot of growth factors that are helpful, but there are growth factors that are not helpful, which is extremely ironic because with COVID, one of the complications or the reason why we have a problem with COVID is because something we call cytokine storm. Cytokine storm is when you have an elevated IL-6 coming in, causing all this dilation of the alveolar and destroying your respiratory system. So this is something that a case of interleukins, growth factors that can cause harm to the patient. So when you do a PRP, you are doing the same thing. Not always. I mean, if you are happy with PRP, then that's fine, and you're seeing the result. But this is the thing that I'm always uncomfortable with when you give people using growth factors without knowing what growth factors are and what sequence that you're giving to the patient, or what the consequences with that. But when it comes to acute treatments, you know exactly what growth factor you're using. You're not guessing. It's been laid out easy for you. You don't have to take blood from the patient. You have to don't do centrifuge. You don't have to do all these processes. You can just do the treatment, follow the protocols, and then you get the result. A lot of papers being published scientifically, paper being published about AQ products and how effective they are. So there's no guessing here. You know, we've been in the market for over 10 years. The results are globally accepted and it's been used worldwide, and they are safe. You know, a lot of cases with PRP, there's a secondary infection, there's complication, assuming you don't even get the result a lot of the time. So I think we should be careful with PRP. So AQ is safe, it's faster, it's cheaper on the patient. There's no risk, and the results are guaranteed, and they're published. So you're safe in multiple things. So of course, I always speak against PRP. But you know, if you're happy and the patients are happy, then that's fine. But you know, I will ask you to reconsider. Ben from the Philippines, would you, as a surgeon, routinely have your elective cases tested for COVID prior to scheduling? So that's a very good question, Dr. Ben. Usually, in this case, it's actually not a point of opinion. Like, I think we should do that, or we think we should do that. There is very strict guidelines put by the health authorities in every country, and what elective surgeries are available can be done, and what the protocols you have to follow. In general, once you do a surgery, you have to use an aseptic techniques to prevent infection. So if you're wearing your gloves and your team is wearing their gloves and wearing their mask and they're taking precautions, and then you're operating in a COVID positive patient, it won't matter as long as you make sure that the cleaning is proper and you're taking all these precautions. But every country have their own guidelines. Do I think that people who have COVID or should take a risk and going through a surgery that is not necessary at this time? Absolutely not. I don't think that is worth it for elective surgeries. But if it's a must do surgery like a heart attack, or you're doing something that going to save the life of the patient, then indeed doing a test is something that you can do very quickly if you use an isotype type of testing. If you do even an RT-PCR question, it takes 3 hours to get the results. So it might be to feel comfortable, but in general, if you do surgery, you have to take all the aseptic techniques to ensure that you're not infecting the patient or the patient is not infecting you. But I will not do any elective surgery at this time until I'm sure that this whole thing is safe. I just won't take a risk as a doctor. You don't want to take a risk, and then if something happens, complication, then you're the person who will get the finger pointed at. Another doctor, my dear friend, Dr. Gianni, she's saying, do you think stem cell infusion will plays a role in recovery from the COVID infection? So there is as you know, there's a treatment that took place in the UAE using stem cell to inhale droplets of stem cell, and then the patient will inhale it, and then the stem cell will come in, reduce the cytokine scan, and then repair the alveola. So they've been talking about in the UAE. They've been testing it on the patient, and the result has been positive. However, it's all been in the news. Nothing scientifically came out. There's no publication that came out to show what they've done and how they've done it and what kind of results. So I cannot give you a scientific answer about it. But I was very intrigued by this, so I went into the World Clinical Trial Organization, which is all the clinical trials are listed there that take place for COVID. So I look at the clinical trial for the stem cell has been listed, and I found there was eight clinical trial has been listed, in the 6 of them from China and 2 from other regions. And then I found out that this clinical trial, 4 of them been terminated using stem cell, and the others are not active. So somebody filed for clinical trial, got approval, and then somehow they could not finish them or did not move on with them. So this is so far what I know about stem cell. Once the paper comes out and we look at the data, I'll be more than happy to give a lecture and explain what happened and how they work. My personal view, and I'm sure a lot of you are asking me for what I feel, I'm hopeful that it works. Scientifically, I don't see any link. Like I have a lot of scientific questions that I find it challenging for stem cell to go in there and cause this as a treatment, especially for viral, because once the stem cell comes in, they become cells. So what's stopping the virus from infecting them and causing, so you're giving more food to the virus kind of thing. This is one of the questions I have. Another thing I have is what make sure that when the stem cell come to the lung, it will become lung cells or, alveolar or any, how do you know that? We don't know that. Will this cause more of the immune system to even panic and cause more cytokine secretion? We don't know. So there's a lot of questions that we don't know about. So I really waiting for the publication to come out. I want to study it, and then I can, I will know exactly what happened. There's another question. So I hope this answers your question, Doctor, and I'm looking forward to see you hopefully soon in Kuala Lumpur. Anonymous, can you repeat again about working with doctors and clinics to increase patient visit? Yes, so basically what we do, we're going to do a lot of promotion, treatment and promotion. So basically we're going to say there are treatments available for hair treatment. There's a treatment for skin. There's treatment for a lot of people who've been using a lot of alcohol on their hands, and they're using a lot of washing their hands. They start developing some sort of eczema, on their hands, and they're becoming really dry, and they're becoming, some of them even been saying to us, I don't feel my fingers anymore. So this is something that the UK even have mentioned it, which is, I'm very proud of them because they thought about it, is using the active serum in your hand. The active serum will reduce the inflammation, will increase the repair of your skin, and bring back your normal hand color and texture. So we will start doing a lot of this type of promotion for the patient, not just for the doctor, but we're going to promote for the patient, and then we're going to highlight doctors' treatment. So we're going to show all these doctors who do the treatment to the patient and tell them what options they are. We're also going to give doctors starter kits, that the promotional kit, that they can have a product and they can use it so they can generate revenue and start learning, and then giving them some sort of leverage there and increase their profit with AQ products. So there'll be some discount, there'll be some promotion in terms of marketing. There'll be training for them as well, what kind of things. As you know, there's a lot of skin problems that took place right now during this lockdown the last 3 months. We have stress-induced alopecia that is becoming one of the news everywhere. A lot of people are start buying AQ products from even sources online that are not proved, or fake copies of AQ hair. We're getting bombarded by emails asking people about, and doctors asking us what treatment that we can provide for patients who come to see them. So of course we're going to do that, and we're going to make sure that people know about this. So it's quite intensive program, and your local distributors will be able to advise you and go take you through it. So please keep in touch with your distributors and if you have hard time finding them, you can email us directly, and we'll give you an answer within 24 hours. Okay, another question. We'll go to, let's see. Could you give us some advice on protocols to incorporate recovery serum with ablative lasers? Yes, so as I said, we just got a paper that got published literally weeks ago. They done very good study on how to use laser and recovery serum. The paper is available to your local distributor. You can, and it's also available on our website. Contact your distributor and they will send you the actual paper, so we have it. I also have it in my Facebook. I think it's published on the Facebook and our AQ Skin Solution page. So get the paper, read it. It's a very nice paper, and take you through the details of what they've done and how they use it. In general, it's basically once you use your ablative laser, you apply recovery after that. It's very simple, nothing else. Once the treatment is done, you apply recovery after that. And you can also, if you have access to the AQ mask, you can also use that for cooling and reducing inflammation. So my advice is you take the mask, you put it in the fridge, make it cool. Once the treatment is done, I put the recovery on the patient to make sure until I see the skin is dried and the recovery has been absorbed and it's been incorporated. After that, you know, I put the mask on the patient, the cold one on the patient. If you do the face, if you're doing other part of the body, you don't need to put the mask. You just can put the recovery serum on top of that, and that's it. Some doctors recommend that they give the patient the active serum to take home and they apply it after that. If you're doing the face, then should be the protocol for you. The results are fantastic. The downtime minimum, and the result, you know, you enhance your treatment. So, and you prevent all the side effects, the pigmentation, post-inflammatory hyperpigmentation. You prevent that skin dryness. You know, we tell people, even, you know, in California, you know, if you're going to go to the sun, make sure you put your active serum on, you put recovery, and then you can go to the sun. That's fine, because your skin will be protected really that fast and will be healed. So your barriers will be closed that fast. So yes, I will advise you to make sure that do not do any laser without the recovery next to you. You only need a very little bit. So one vial will be good enough for 4 treatments. So the cost is very minimum for the benefit the patient will get, and it should be part of your protocol. To add to the experience, you can use the mask. Our mask is a hydrogel. It does not irritate the skin. It's not a paper, so it will not rub against the skin or the lesion. It's gel. It will hydrate the skin super quickly. It's very comfortable. It's very good to use, and I advise you to do that. Okay, I hope I answered this. What is the best to treat man's beard? Okay, so this is very good question, in the sense that we had a lot of people contact us, and mostly in the Asia. So I can tell you my experience in Japan. I was in Japan. We had an event, and I gave a lecture there, and then after the lecture they had a reception. So we're sitting there, you know, eating and talking and, you know, mingling with everybody. This doctor come to me and asked me, what do I think of his beard? He was going to say, do you like my beard? And I found the question to be extremely kind of weird. So I say, yes, I like it. It's, you know, it's good. He's like, you know, I don't have beard. So he starts showing me a picture of his beard being really thin and not as thick. And I said, good. And he said, do you know how I did it? And I said, no, I don't. And he said, I use AQ hair complex. I put it here, I macro needle here and there, and then I get the hair came out. So I never recommended or told people to use the hair complex for the beard. But I was pleasantly surprised to find out that in Japan, it's actually quite as popular treatments, and they start using it for their beard. And they said it works good. It's, you know, it helps make the hair thick. It works really well. And the treatment is available. As a company, we cannot promote it that way. Of course, if you understand the science, underlying the science behind how the hair complex works, you will understand why it will do that. But, you know, as a company, we haven't done clinical trial on it. We haven't done testing on it, so I cannot recommend it, you know, because of my position in the company. But I guarantee you, a lot of the doctors worldwide are using it, and they are getting a very good result with it. So you can try that. And let's find another question is, we treated a beard with AQ hair. Oh, this is from Scalp Confidential in the UK. Kelly, hi Kelly. Kelly is an expert in hair. If somebody in the UK, just go there, get her. She's one of the best. So she said, we treated the beard with AQ hair complex. Haven't got follow-up photo yet due to the COVID clinic closure. The client seems happy with the result from a brief call. We'll be happy to share with his permission, of course. Thank you, Kelly. Yes, so yes, I know it's been used quite a lot, and you know, it's the result is actually quite good. So yes, let's see. Another question is, thank you, doctor. You're welcome. Could you give us some advice on? Okay, no, I took this question. Hi, doctor. I don't know if you've been asked, but could you as in nebulization could help COVID damage? So there has been talk about using growth factors to repair the skin, the lung, and it's quite a very good hypothesis that, listen, the lungs respond really well in terms of absorption. It's very easy for the lung to repair faster than actually other organs, like the liver and then the lungs. I think one of the fastest repairing organs. And they say that, you know, if we give growth factors, they'll do two things. They will inhibit the cytokine storm that you see with increased IL-6, for example. They will help and repair the thing. It's not cells, so they will increase the immune response in the lung, and thus defeating the virus. There's a good science can support that. However, it will not be an easy thing. And to get it approved for biological is another complication. Can this be a future treatment and future field to look at? Absolutely, absolutely yes. But right now we are looking at the most traditional and what's available in the market to treat the virus. So vaccine and already approved drug, we call it repurposing. I gave a lecture 2 years ago in the IACSO conference about repurposing drugs, and I was telling people repurposing is the new field that everybody should be focusing on. I always tell people repurposing is the future of medicine. Regenerative medicine and repurposing medicine is the future of medicine. And I've been telling people this, and I gave a lecture about it, and I've been asked to do it again all the time. So this is what's available right now, but this is absolutely a good idea, and hopefully it can be done, and I'll be more than happy to help. So thank you. Another anonymous saying, I represent a company in Italy of pressotherapy machines. What are the best aesthetic machine besides pressotherapy for it to be interesting to sell in Dubai? I'm not sure. I'm not sure about that. I don't know how to answer this question, but I can tell you one of the places that you can come and visit and look at what's in the market if you want to do a business in Dubai or the Middle East, even in this matter. I would advise you to attend Dubai Derma. It happens every year. This year it got cancelled, and it got postponed to June, and then it got cancelled, and now it's back to its normal. Next year it will be in April and March. I will advise you to attend that, and you can ask the questions or find things. If you want to do it quicker, in September the conference is Medan, which is the second biggest conference in the Middle East after Dubai Derma. It's happening in September. I think it's 18 or 15 to 16 September. I'm not sure the dates. You can Google it, Medan. MEIDAM. So basically, and it's and this is something I encourage you to attend if you want to know about what machines available, and if you want to find a partner in the Middle East. Then this is something that you can attend. You can contact me. I think I have my my Instagram on at Dr. AQ Skin. And you can text me on Instagram, and then I can give you the dates, and and then help you introduce it to people if you want. So I hope you're safe in Italy, and thank you for joining. Hello, doctor. Is it okay to use Dermastem on acne skin? Yes, absolutely, absolutely. We've done a lot of. Hi, I'm from Indonesia. I'm Roberto. Oh, Dr. Roberto. Yes, yes. In Indonesia, it's actually they're doing a great job and doing training. They have training all the time, and I advise you to attend the training. Unfortunately, I couldn't. I was supposed to be there to visit March. I was supposed to be there to visit my friend Raymond. I pray for him, fast recovery, and then also to do training. So I will ask you to contact the Indonesian distributors. They do great training. There's a lot of doctors in Indonesia that are certified to train people, and they do great job with acne. Dr. Jennifer Petra is somebody, if you know her, you can contact her, and she does also training. She does it for free. She's happy to do it, and she also can show you on the patient that she sees. So I advise you to contact her and get in touch with her, and then they do training all the time. Indonesia is one of the best markets that it's close to me. I mean, all my markets are beautiful, but Indonesia have done quite an extensive amount of training. So they do training almost every month. Their support service is amazing. So, I would advise you to contact them for sure. And if you need help, you can contact me too, and I will be able to help you with that. Hi, Dr. Natasha here formerly from Dermalace, Dubai. I'm in Singapore. I'm seeing several patients. Oh yes, Natasha, how are you? Minor skin trauma like burns, etc. Doing a lot of Dermastem. Will you be introducing a stem of a slightly deeper penetration to that treat existing scar tissue? Yes, we already have that. So we have the 0.8 and we have the 2.1. And also we work with some dermapen company that can also help you. If you are an AQ account, you get discount almost in cost. You don't even pay. You get it really cheap just because you are an AQ account with the pens. So I will advise you to contact Dylan. Dylan is our distributor in Singapore. He's one of the best. Again, Dylan is a fantastic. They do a lot of training. You can contact anybody in Malaysia or Singapore. They'll tell you about the excellent service that Dylan and his team does for the doctors there in training. So, AQ Network has invested drastically a lot of money and support to make sure that everybody get trained and get the treatment. So ask them, he'll be able to help you for sure. Since you're from Dermalace, you're an expert in AQ. I know Dermalace is one of the great clinics in Dubai. They do a lot of treatment for AQ. So yes, contact Dylan. If you want his contact, you can contact me, and I'll make sure I'll pass you to his contacts. So yes, let's go to another one. Hello, Dr. Ahmed from Indonesia. Really like what AQ serum result. Oh, I'm happy. I'm happy. I hope you tell us your name so we can say thank you. But I'm happy to hear that. And please be safe and continue your hard work, and hope I can see you soon in Indonesia. We will be getting in touch with you, Natasha. Okay, great. Here we go. I told you Dylan are the best, so they'll contact you, Natasha, and they can work with you and help you. Hi, doctor. Can we use Dermastem on active acne? Yes. Yes. Again, contact if you Dermastem with the recovery serum, you can. Dermastem or pen alone, I advise you not to. But with using recovery serum with a Dermastem, you are absolutely safe, and it's been tested. Again, there's paper that's been published about this. It's safe. Contact your distributors. They will tell you exactly what you need to do, what service is available for you. They'll show you their cases before and after, and what kind of treatment they've done. And we're making an AQ book right now that will have all the treatments being done for patients, and then the doctor's signature. So you see before and after pictures of the patients, and then you see the doctor's signature underneath it explaining what happened. So it's like a book. It's a fun book that we're gonna be building up to make so that people can learn and doctors can use to explain to patients. So stay tuned for that. So yes, please contact your local distributor, so this way they will be able to advise you. Another question: can AQ hair solution be injected or only by themselves? Yes, it cannot be injected. It's not indicated for injection. It's for only using with dermal stem. Also, you don't really need to inject it. If you inject it, you will go way deeper than where it needs to be done. You need to place it near the papilla to stimulate the cells and the repair of the follicles. So if you inject it, it will go way deeper than where you need it to be. That's why we recommend to use the stem. The stem will be perfect location where you need to put the solution. So please use the stem, don't inject. And also, if you are not trained on the growth factor induced therapy GFIT certificate, then get in contact with your distributor, and they'll be able to schedule you a training, and they'll be certifying you, and then you'll be able to use all these treatments quickly and effectively. Kalium from Greece. How can we have training right now via Zoom for the distributors / countries? Also, the Dermastem is one used product. Can someone use it at home? So Kalium is our distributor in Greece. It's one of the new countries that we sign up, and they are so they'll be listed in our training during the tour in Europe. So we will be visiting Greece, and we'll do a lot of training there for the doctors and so forth. So training right now via Zoom. We're not going to at this moment, but we can arrange training for your team if you want, and everybody else, or we can have ask the Kalium, the Middle East distributors, to arrange training, and then we can do that. Dermastem can be used once. It depends. You can use it multiple times. For the hair, for example, you can use it multiple times as long as you use it in the same patient. So if you're using the same patient, you can use the Dermastem multiple times. You don't have to use it once. If you do it on the patient for one treatment, and then the same again for the face, I will advise you not to use more than twice with the things with the Dermastem. So yes, you can use it multiple times. Can use it at home. It depends on the patient. I'm usually not very happy to give the patient the Dermastem at home because I'm not sure how clean the house is, what the problem will be there. Are they going to maintain the stem to be clean? We had seen in the past, so people getting the stem, taking it home, and then get contaminated, and then they start doing the treatment, then they get complication, and then of course they don't say, we made a mistake. They say, well, the doctor gave us the stem, the product is not good, it's causing the problem, and then you'll get into this procedures, this scenario. So I advise you not to. I have a news here from Kalium. Will be more than happy to help with anyways. Kalium are always happy to help for training. Kalium has been with us for 7 or 8 years. It's one of the most, one of the biggest companies in the Middle East. They've been in business for such a long time in aesthetic, and there have been huge support for all the doctors and clients they have here. So yes, they'll be more than happy. So I can talk to them and see what they offer and what kind of treatment they do. They also, Kalium also is on the IMA, the Institute of Medical Aesthetic, and they do a lot of training there for laser, for injectable, for growth factors. They do a lot for threads. They do a lot of treatments, anatomies. So they do a lot of training there for aesthetic. So I'm sure they can do that. I feel like if you do training on Zoom, where there's no feeling, I can talk about the theory about AQ and everything, but training require hands-on. You know, when I do training for doctors, I will be there, we'll see the patient, we'll show the techniques, we'll correct the doctor, move their hands, put their hand, tell them not to do this, do that. So there's a lot of interaction. So I don't know if we'll have a very huge impact using Zoom, but you know, we're open to it if it helps. But you know, don't worry, we're going to come to Greece and we're going to make tremendous amount of work and training for the doctor. So you rest assured, you are in one of the top in the list. Hi, Dr. Ahmed. Can you tell us about the treatment of melasma, Euro clinics in Belgium? This Diane? Okay, so melasma is very interesting condition, as you know, and you are expert in this. Can you tell us about treatment of melasma? So melasma, I am very careful with it because the melasma is so unpredictable sometimes. So I refer, my protocol, what I recommend is you tell the patient, it depends on the degree of the melasma. I tell the patient if it's slightly getting there or posting, it's not hormonal, I recommend to use the recovery serum with microneedling, but very low depth. You don't go deep, 0.8 is enough to do the treatment. And then you wait another 10 days and see if there's any improvements. And during that time, I put them on the active serum to use it every day. So once they do that, my experience has been extremely positive. And we have very good cases. I'm sure you saw it in my presentation with people with melasma, very stubborn melasma. They use medication, everything, chemical pH did not work. Once they start using the recovery and the active serum, the result has been tremendously fast and safe. And the good thing with it does not have to come back. So when you use the doctors, you prevent a rebound. Rebound melasma is one of the toughest things that you can treat. In fact, a lot of doctors, they don't even attempt to do that. But when using recovery and growth factors, you repair the entire skin process, you repair the entire melanocyte production. So I recommend that for sure. And we will do training, obviously, in Belgium and Holland. We're going to be doing the tour there, and we'll do training for them, for everybody as well. Have you had result with recovery serum treatment for pigmentation? Yes, we had great result with pigmentation. And I think the paper that published also mentioned that, because one of the problem in Egypt, the skin is a little darker, so they are dysphatic 3 and 4, so they're very prone for when you use laser on them to develop pigmentation. So they mentioned the paper that when you use recovery serum, you actually repair the skin, but you also prevent pigmentation from taking place. So absolutely, recovery serum is one of the best treatment you can treat for pigmentation in combination with the active serum. So that is extremely effective, and I advise it. Another question. Hi, doctor. What is the protocol treatment with AQ hair complex in case hair of transplant? And can we use Mesogan? So that's a very good question. So when you do a hair transplant, the hair is already there. So what you need to take care of is you need to make sure that the trauma is reduced, because as you know, inflammation can hurt the hair follicles. And you need to stimulate the hair follicles to keep them alive and to keep them strong. So that's something that the doctors, I know the doctors in Istanbul and Turkey, they use it. The doctors in America, we use it. The doctors in the UK also use it. Doctors in here in the Middle East, they use a lot of it, and other countries. So the way they do it is after they do the treatments, so there's two ways going. You can do it pre and post. So the pre-treatment is to do the treatment for before the hair transplant. This what it will do. It will help the area where you put the hair in, so the graft, the area that will take the graft from the hair, so the hair will be thicker and stronger. So it will be more blood supply. The follicles will be really strong, and also will prepare the area where you're going to implant them. So you can do that. So you do treatment at least 2 sessions before the hair transplant. And then after the hair transplant, you use the recovery serum, the hair complex, and then use it topically. You don't use it with any Mesogan. You don't use it with anything. All you need to do, you just apply it topically, because already the skin is compromised. It's open. So you don't need to really push it in. All you need to do is just apply it as a mist. I always tell people you can put it in a sprayer and then just can spray it all over your area and also on the back, so it will help with healing. It will stimulate the hair follicles. And then the hair will be thicker, and the follicle will be strong, and the hair will be thicker. So you'll get really quite great results. One of the doctors was telling me, actually, one of the problem with hair transplant, you can form fibrosis. You have form scarring, because remember, it's quite an invasive procedures. Like you have to plug everything in, so the skin can react, and you'll have fibrosis happening. Using the hair complex with the growth factors, actually, you'll eliminate that. So you don't have to worry about fibrosis. You don't have to worry about scarring. You don't have to worry about problem healing, and the result come really quickly. So the patient can really, within a week, they can have no sign of any trauma in their head. And also the donor area will be very well healed and back to normal. So absolutely use the hair complex for hair transplant. Amy from South Africa. Hi, Amy. We will be conducting theory and demonstration basic Zoom training in South Africa. Wow, wonderful. Can you announcement? So they're going to announcement. I hope Amy is very good making announcement on Facebook and social media. So when you announce it, I'm going to re-announce to everybody, all to our network, and then people who are interested, they can join your training. So thank you for that, Amy. Appreciate it. Send me the links and I'll make sure. Doctor, can we combine AQ recovery serum with Botox and hyaluronic acid for fine lines around eye and neck? Absolutely. So my protocol, or what I recommend, is you do first the AQ recovery serum first treatments. After you do that, you do the Botox. You don't do the Botox and the treatment at the same time. Okay? So you do the treatment first and then you do the Botox. The one thing about Botox is if you do Botox, right, you only tackling the muscle for to prevent you're tackling the muscles, and the muscle can help with refined lines. However, to get the full skin to be plump and to be healthy and look natural, you need the recovery serum treatment. So I will always tell people, you know, before I start or doing the Botox, let me fix me is healthy and plump. Once you see that the skin is healthy, and then you'll be able to place your Botox in the right spot to give maximum effect. Hyaluronic acid is a temporary thing. If you want to do, if you're talking about fillers, yes. So again, fillers and Botox do not fix the skin. All they do is the fillers fix the contour of the skin of the face, and the Botox fix the muscles. The skin they don't affect the skin in whatsoever. So doing an AQ recovery serum is a tremendous result. You get great results. So I will do that first, and then tell the patient, after we fix your skin and make sure your skin is healthy and plump, then just go and do the Botox for you and the fillers. So this will have a fantastic result, an amazing result. So absolutely, yes, but do the recovery first. Don't do it after. Do it first. So do the treatment first, and then do the Botox and fillers for fine lines. And of course, for the neck is tremendous, and around the eyes, absolutely. I think we got through all the questions. If somebody have another question or comment, with a setting machine, do you recommend selling in Dubai? Yes, it's very good. Which static machine do you recommend selling in Dubai? I mean, it depends on the stack. I don't have very specific machines that I recommend. I usually think that you can just do it based on the market need. But aesthetic market in Dubai and the Middle East is quite large, and it's a good market to be in. Hi, doctor. If a patient has experienced a superficial burn and applying AQ serum, when would you recommend starting the stamp with the area with AQ? So if there's a burn, I recommend that you don't need to use microneedling. All you need to do is, this is Michelle. All you need to do is actually apply. There's no the skin's open, so just using the AQ recovery serum on the burn, it will help it heal and prevent scarring and pigmentation. If you want to do microneedling later on, just make sure that the area is healed and it's closed, there's no pigmentation, nothing, and then you can do microneedling. But you don't do microneedling for the burnt area. You just apply the recovery and it will take care of everything for you. Another question is, can AQ be dripped into an ulcer to promote healing? Yes, absolutely. Absolutely. Yes. So AQ was designed for ulcer and wound healing, actually, but yes. So yes, we are, and they are if you attend Amy's talk training, I'm sure she's going to be talking about ulcer and wound healing. But yes, you need to use the AQ recovery serum. You apply it on top every 3 days, and the healing will be so fast you'll be amazed. It is a lot of people think AQ recovery is being used mostly for aesthetic. Actually, I would say 50% of it uses for aesthetic, and 50% is used for post treatments, for post surgery and wound healing. So yes, for sure. And again, contact your distributor, and they can show you protocols on how to do it and how you go about it. So I recommend you to do that. Can we use recovery serum for hands, and it will be with stamp also 2.1? The answer is yes. You can use the AQ recovery serum for hands, and I recommend you use the 0.8 stamp, not the 2.1. There's no scar. You don't need to go deep. If there's acne scarring, if there's something of a scar, then yes. But if you want to just plump the skin, make the skin healthier and more tight, then yes, use the 0.8 is more than enough to do it. You apply it, you do recovery, you do the stamping, and then you apply again, the sandwich technique. Again, I always recommend people to get trained. AQ Network provide training regularly worldwide. You can just go there and contact your local distributor, and they will be more than happy to conduct the training for you and take you through everything. So please make sure you get certified and you get trained. It's free. People are more than happy to do it. You are not committed to buy anything. We want to make sure that when you use the product, you use it correctly and use it well, so you get the result, safe and good result for you and your patient. So please make sure that you get the training. So training is available for everybody worldwide. Okay, let's see. I think, oh, sorry. Can we use the serum in conjunction with ion reinforcing devices? Yes, yes, you can. So you can use it with the AQ recovery serum. Ionophoresis, yes, you can use it, the recovery serum. So the way you do it is you can do it both ways. You can do the phoresis first, and then you apply the recovery serum, or you can do it in conjunction. It depends on what device you use. But in general, any device that will cause a trauma to the skin, and you need to prevent that from happening, or if you use laser, if you use radio frequency, if you use anything, chemical peel, make sure that you use the recovery serum with that to prevent any complication and to promote healing. So I always recommend that. Can we use, yes, it's home care. Yes, so the home care, you can use that. So the active serum at home, you can use the active serum for sure. Okay, doctor, if we have old scar, is it better to use radio frequency or stamp with recovery serum? And what is the time interval and how many sessions? So that's a very good question. It depends on the scar, and it depends on radio frequency can be used and stamp can be used. So it depends on what your preference. My preference has been always stamp, because mechanical damage to the scar tissue, we call it scar revision, is way more precise, in my opinion. For me, I'm sure other people say I like to use radio frequency for that, but for me, I will go mostly with stamp. It's cheaper, it's easy to use, and this is the interval. It depends on the stamp, and really depend on your technique. Remember, this is a procedure, so the more you do it, the more you become skilled, and the more you become, So we have people who do scar revision in one session. We have people who do scar revision in 2 sessions. So it's only depends on your technique and your skill level and how much you've done the treatments. We have experts who've been doing this for a long time, and they get tremendous results. So my suggestion is stamp with recovery. Time interval, I would say between a week to 10 days. It will be usually the session, and the number of sessions depends on the scar, of course, and your technique. So yes, 10 days, a week. Some people do 2 weeks. Doesn't matter. The paper that just got published, they talk about that too, using a fractal laser. So you can also look at that, but I think they did it in 2 weeks. The recovery is quite tremendous. It worked really fast, so you can see results really, quickly. I always tell people you can do it based on your schedule. So if you're free, you can, the recovery will be fast, and you can do the treatment again within a week, if not even faster than that. Another question: is active serum good for active acne? So if we use active serum for acne after you do the treatment. So once you do the treatment in the office with the stamping, or if you use laser, fractal laser, use recovery. After that, you can use it at home to apply the active serum. Yes, it helps. As people use the active serum alone without a treatment on acne, yes, but not. It depends on the type of acne and the intensity of the acne. If it's little bit, yes. If it's really heavy, then no. You need to have a treatment for that. So that's the with the active serum. Okay, I think we came up to we answered all the questions needed. If anybody have any more question, I'll be more than happy to answer. Again, thank you everybody for really coming in, and I hope you are staying safe. If you guys have a question about COVID or the whole event, what's happening, you can ask me and I can tell you my opinion on that. I've been following the news quite close, and I've been following all the procedures and what's been happening. I am hopeful, and it seems like June will be the time when everything is going to slowly, gradually get back. So June, July, I think it's the late summer. We should be in good shape. But live your life, be happy, don't stress, do your best. I used a lot of my time to catch up on my reading. I started educating myself on other things that I always wanted to learn about. As well as keeping pace on what's happening and what type of AQ business. Thank you, Dr. Sharon. You're welcome, Sharon. Okay, we have 2 more questions. Let's see. Oh, hi, Ahmed. I love the products. Diane yes, Diane, you're the best. She's the very best, actually. And thank you very much for the session, Dr. Ahmed. Unisum from Indonesia, Sarah, and the whole Unisum team. Please say hello to everybody there. Pass my regard to Raymond and Jennifer and everybody. And I'm going to see you soon. I hope I can see you during the ice swamp. So let's see. Janati, thank you, Dr. Ahmed. You are awesome. Take care and God bless you. Thank you so much. And MSAM, I don't know when MSAM gonna happen. MSAM is okay. It's gonna happen next year, I think. So hopefully we can see each other before then. Be safe. Please say hi to all our team there, all our friends in Malaysia. Charlie and from Kelly. Yes, thank you. You're welcome. You're welcome. Charlie, Kelly at Scalp Confidential. Yes, you're welcome. Looking forward to see you in London for sure. Okay, let's see. We love AQ, and AQ love you back. I know the girl is crazy about you. So see you soon in London, I hope. Every summer I go to London. If I don't go this summer, I'm gonna be very sad. But hopefully we can go there. Thank you so much. Take care, Dr. Nasima. Yes, you're welcome. And thank you for your Instagram support and messages. They are wonderful. AQ Ballistic State. Thank you. You hope to see you soon in Estonia. Yes, for sure. You're going to see me soon. And I look forward to seeing you there. Sarah from Kalium. Thank you, Dr. You're welcome, Sarah. You're the best. Hang in there. We'll do it. So, Amy, thank you, Doctor, from all the AQ team. You're welcome, Amy. I can't wait to see you in South Africa. Soon we will be there. Just hang tight and we'll be there.
That was a great session, Dr. Ahmed. Thank you so much. Really appreciate it.
Thank you, guys. Thank you. Take care, and I'll see you soon. There's a new message from Can Recovery Serum Improve Vitiligo? You know, as an immunologist, I have a lot of things. No, I have not seen anybody using AQ for vitiligo and getting me a result, frankly. If anybody can share with me, I usually ask a lot of doctors, dermatologists especially, what can they use AQ for, what can their protocols. I haven't seen anything for vitiligo, so it doesn't help. Nothing that I know about. So, but once we see that it can help, I'm sure it helped for sure with eczema and psoriasis. The results are fantastic, but with vitiligo, no, unfortunately. Or maybe I mean, but I don't think so. I didn't see anything, and nobody talked to me about anything that can help it. So hopefully we learn something new in the future. Okay, one more questions. Let's see. Thank you from the UK team. You're welcome, Michelle. You're welcome. Take care. Look after yourself, and hopefully we'll see you soon. Okay, Arthur, it's all yours.
Great. Thank you very much, Dr. Ahmed, and the attendees, whoever was there today. Thank you very much. And we shall be hopefully be organizing another session with Dr. Ahmed Al-Qahtani soon, maybe in about 2 weeks, wherein we will discuss more about AQ, the growth factors, and the new study that that has been done by AQ recently that Dr. Ahmed also mentioned today. And hopefully by then things will be getting better in relation to COVID. Thank you again. Thank you very much, Dr. Ahmed. Thanks a lot.
Welcome. Thank you, Olga, and thank you, Kalopi. We'll be in touch soon. Take care. Look after yourselves.
All right.
Ciao.
Bye.